So today I'm talking about how to retain a beautiful result of your teeth whitening treatment. Actually, I decided to create a list of questions that patients ask me most frequently, and this is one of them. So the question usually asked is, I had my whitening done with dentist, and I heard that this is not for life. How do I avoid repeatable procedures, and how do I retain the lovely color of my teeth for longer? Very, very easy solution. So good news here. So two things you can do. One is obvious. You really are better off because of health reasons as well as aesthetic reasons, visiting your hygienist or a dentist for regular tooth cleaning. I'm talking about scale and polish, obviously for health reasons, when we are removing all the debris which is packed under the gum to which you don't have any access to, even if you're a good person and trying your best. I'm talking about this combined with a procedure called airflow, air abrasion, sandblast, name it. It's whoever is a manufacturer or of equipment of a brand that we dentists are buying. They have their own name. They all want to be imported this way, so they put their own name. Anyway, the idea is that this is a very, very, very gentle spray of powder and water directed onto your teeth, which removes everything from everywhere. Even in those little undercuts, little shadows where even the tiniest dental instrument struggles to get through because it's there's no space, powder and water jet will get to and will clean it all. So we'll remove all the staining from your favorite red wine, Ribena, tea. By the way, tea is even worse than coffee in terms of staining. Anything colorful we eat and drink leaves staining. So unless you eat cauliflower and a Greek yogurt, that's it. You will always have a bit of staining. So yes, so first visit your hygienist regularly. What I mean by regularly is, for one person is once every 6 months. That's, by the way, the golden standard. And for the other person, it might be once every 2-3 months. Again, it might be dictated by the health situation and suggestion by your dentist or hygienist, or by the way you feel. Maybe you smoke and you have a bit of more staining. Maybe you love red wine, which leaves more staining. Maybe you're fond of your multiple teas during the day, during every day, and tea leaves a lot of staining. Therefore, our teeth have this little film of kind of yellowish, brownish staining. And when you will see the hygienist, and that all will go. By the way, it's completely painless. Airflow is a completely painless procedure. I love it. So very much encourage you to have it. So yes, so you will have it done. So that's one thing. And the second thing, very easy. You have already received from us, from the dentist or from the hygienist, your whitening trays. Doesn't matter if you have undergone the procedure of whitening teeth at home or only in the surgery. Zoom whitening and lighten whitening, you name it. There's just so many different names, and it's all the same chemical with different strength and the ways we are using, but it's all the same. So you have your trays, you have your spare whitening gel. If you are low on it, please come to the dentist. Do not buy anything like that, anything medically inclined from internet, please. Everything these days looks original. Is it? If you are lucky, at least you won't harm yourself, but please be very careful what you're buying. So get your whitening gel from the dentist. Put your whitening gel in your trays for 1 to 2 hours. Now it depends on you. One person does it once every 2 months. The other person does it every 6 months. Both are fine. It really reflects your needs. So I would suggest, on average, do it once every, say, 3 months. Put gel in your whitening trays. Put those trays on your teeth for 1 to 2 hours, and you're all done. because you have all the background work done before with the dentist. Now you're just refreshing. It's just refreshing. So you can enjoy your beautiful gleaming white smile for longer, and you don't have to have this procedure repeated constantly every 2-3 years, and you don't pump money when you really don't have to. Yes, I hope it helps.